Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. Today on the Healthcare CEO Show, I'm joined by Chris Davenport, CISSP, CCSK, Allegrow's Global Data Security Advisor, and Fractional CISO. Chris brings 25 plus years in high-stakes environments, from community health systems to state and federal agencies and global enterprises. At Allegrow, he helps healthcare leaders strengthen HIPAA and NIST programs, prep for SOC audits, and build pragmatic security roadmaps that reduce risk without slowing growth. We'll dig into why cybersecurity is now a CEO issue, why healthcare is a top target, and the concrete steps leaders can take to protect operations, reputation, and patient trust. Chris, welcome to the show today.
Thanks, Daniel. It's a pleasure to be here.
Now, security has been, if someone's tuning in today and they've been following the show, it's been a hot topic and it's come up on multiple shows this season specifically. But before we dig into the security aspects of things, give us a little bit of your background and how you got started and, some of your experience across healthcare, government, and global enterprise.
Okay, sure. Happy to do that. My history with the career-wise goes back quite a ways, like you said, 25, 30 plus years or whatever. I actually started in the banking industry, so I got my first start with exposure to IT and databases and working with technology back in those days. And I went from there to actually completing a CFP program in which I left the banking industry and began to get into healthcare. I got into healthcare by first managing medical practices, orthopedic, neurosurgical, different organizations, cardiovascular, that sort of thing. Did a lot of work with that, did a lot of work with hospitals. And during the course of that time, I had a company out of Texas pick me up, and we started doing a lot of work on HIPAA. That was one of the things that I was involved with the focus groups in Washington, D.C. back in 1996 when all that was going on. So I'm kind of showing my age here. But for the most part, I basically spent most of my time in healthcare on the provider side of the house. I've done over 150 assessments with different hospitals. I also work in the financial services industry as well as the telecom industry. And my career has pretty much over the course of that time taken me everywhere from Singapore to Nairobi to Washington and to San Francisco and a lot of other places in between.
Now, for some CEOs, they see cyber as an IT thing, right? So yes. What sort of business case can you give us in really 1 minute or less? So the reason they should really be thinking about this more.
Well, in some ways, cybersecurity, and I'm a little reticent to even use that term, but in some ways it's security. I call it information security. Information and data security has a tendency to be truncated as a IT thing or an IT function. That's part of the problem. That's part of the equation. That's the technical aspect of it, but that's not the whole part of the story. A big part of the story has to do with your policies and procedures, your governance process, how you manage it from a CEO, CISO, CIO, CFO standpoint. Because cybersecurity or information security is one of those kind of things that it's a lot like air conditioning. Nobody pays a lot of attention to it until it goes out, and then everything gets hot real quick. So that's one of the things that I think is really important to think in terms of is it affects the whole organization. It's the Mufasa philosophy. Everywhere the light touches is our kingdom. And today's digital society is just more and more that way, particularly with the introduction of AI.
Why is healthcare being targeted so heavily right now, and what attack paths are doing the most damage?
Well, from a top target standpoint, it's like the military. My friends in the military always would tell me, I've never served in the military, but I have served with some great people who were. They call it a target-rich environment. Basically, that just simply means that there's high-value data, that's in there, and the legacy systems and the underfunded IT component of it has been a problem as well. So you've got high-value data. That's the data security piece we talked about. That's sitting in there, and it's a target-rich environment. And so you got legacy systems, the underfunded IT organizations, as well as the criticality of operations, making sure that this information is properly protected, as well as the complexity of the devices. It's not like just running a small business that doesn't really have so many different type of devices. With the Internet of Medical Things, or IOMT as they call it, biomedical devices, MRI things, EEG machines. All these machines oftentimes create, receive, maintain, or transmit information. And by doing so, it's patient information. And that makes it a lot tougher to kind of work through that. The other part of that is the human factor. People in healthcare are helpers. They got into that business because they want to help people. And oftentimes the attackers can use that in a social engineering position to take advantage of their willingness to help people.
Yeah. Now let's talk about readiness. If an organization could only do 5 things this quarter, what 5 things would you recommend?
Oh, that's a really good one. Getting 5 things done in a quarter would be quite a charge. I think for
Agreed.
the most part, one of the first things I would talk about is looking at your governance, risk, and compliance, or what they call a GRC framework. Governance addresses what are the rules, what are the policies, who's accountable for which function, whether the CIO, the CISO, what's the role of the board, what's the role of the CEO, et cetera, et cetera. So I think the GRC part of that is there. So for example, specifically around governance and policy to begin with. And that also kind of leads into risk management. And risk management is one of those kind of things that we have a tendency to just sort of slough off. But you need a good framework and you need a good model for that. The way I oftentimes have explained risk to people that I've worked with is it's a lot like fire, in that you take 3 components that are required for fire, and you have heat, and you have fuel, and you have oxygen. But if you take away any one of those components, you no longer have a fire. It's the same way with risk. And in risk, you've got an attack vector, you've got an asset, and you've also got a way in which that attack vector could be executed. If you take away any one of those 3, you no longer have a risk. So if you have a model somewhat like that addresses it and kind of classifies what's high, medium, and low, that gives you a good handle on that. Then you kind of take those 2 pieces, the governance and the risk, and you put that together with your compliance, which is like federal and state regulations associated with how healthcare organizations have to take care of their data. It's a big risk that if you don't meet the compliance requirements, instead of just the governance or the risk piece of it, that can come back to bite you pretty bad.
Let's talk about the impacts of a breach. Beyond the dollars, what are the real operational, legal, and reputational impacts? And how does that threaten, safety and care continuity?
Yeah, I oftentimes hear people talk about the care, the safety of patients, and that sort of thing, and that's certainly a legitimate situation when you have a high stakes situation, perhaps in hospitals where you have surgery that's going on, particularly as we rely more and more on these systems for actual surgical procedures or actual medical procedures. That could be a real danger if those systems fail. We know today, and I think this was just a few years ago or whatever, that it was determined that the amount of information that a physician or a medical care provider needs to know in order to treat a patient effectively has long passed the ability of any one single or even a group of physicians to collaborate and come up with what the solution is. And that's why oftentimes they're relying on systems when they do research as they prep for a procedure. So from that standpoint, I think that's one of the pieces of the equation, is making sure that the patient care is addressed. That's one of the first things. The other aspect of it goes back to what you mentioned, having to do with the legal aspect of it. There's regulations and laws that can get you in a lot of trouble. The Office of Civil Rights, for example, maintains what I refer to affectionately as the wall of shame, which they post the primary big breaches that have occurred to different hospital and healthcare organizations. It's embarrassing to have your name of your company put on that wall. They're doing that in a way to kind of encourage people to, not get on the wall, not be there,
Yeah.
and to take, the information security serious. Reputation, probably if you're going up the scale, reputation is probably number 1. If you've built up a name as a cancer center, for example, or you built up a name as a major cardiovascular or a medical university center, it doesn't do any good whenever you see that, that your name's kind of slathered across the news media, that you've been hacked or that ransomware has taken your systems down, that sort of thing. So it's a pretty serious thing outside of just what is called the IT thing.
Now, there's a lot of CEOs and healthcare executives listening to this show today. How do they build a culture of security from their role all the way down to the front lines and create a training program that actually sticks?
Hmm. Yeah, any really good security, or particularly from a technology standpoint, any good security program begins with a good set of policies and procedures. Oftentimes, when I've been in boardrooms, sitting in a boardroom, and one of the board members will ask a question about, what about this or what about that? Oftentimes my response is, well, what's your policy? How do you address that? How have you defined how you address that? And most of them can't really answer that, but they say, I'll get back with you on it and we'll have a conversation later. But oftentimes the beginning and the cornerstone of really any good security program is your policies and procedures. Then following along very closely behind that is going to be your training programs. You have to really do a good job building what I call human firewalls. These are people who know about security. They have access, and maybe particularly if they're admins on systems, they have access to that information. And if something's going on, they can pretty much tell you that something is happening. And you want to be those people, be your frontline defense or whatever when you're looking at any type of program like that. That kind of works its way up to management. It really needs to be a grassroots thing. If you can do things like I've seen some very successful training sessions where they'll hand out toothbrushes, for example, and they'll say, don't share your toothbrush, don't share your password.
Ooh,
Or they
good
may
one.
have other types of ways to kind of encourage that. Gamification is a
Yeah.
great way to do that. Set up games and phishing systems to where it rewards people for doing the right thing and walking through simulations. Same thing associated with and we'll probably talk about this later, but recovery is a big piece of that equation as well. So I think policy is the cornerstone. Training and working with your people is probably the most important beyond that. And then, of course, the last piece of that equation is your technical security controls, so that people who not supposed to do things are not actually technically allowed to do those things.
Let's talk about practices that are growing through M&A, and there's always an aspect of due diligence. What are the red flags they should be looking for as part of that due diligence process when they're bringing on new entities, especially as I look to integrate them with the bigger company?
Yeah, that makes a lot of sense. I've done several M&A situations where they were acquiring, either a merger of equals or they're, acquiring a company, and they've asked me to come in and say, I want you to evaluate the other company or reconcile the policies, the processes, the systems, access controls, audit controls, all of that type of thing, and make sure that we're kind of on the same page. If you see a huge disparity between one organization versus the other organization, that's the first red flag. If one organization is doing a really great job with it and the other organization doesn't really pay much attention to it or is not really just sort of tip their hat to it and that's about it, then you're basically the larger organization that's acquiring the other organization may be inheriting some significant risk. And that goes back to my definition of risk. If the risk occurs in the other organization, now their risk is your risk. If it happens to them, it's now happening to you. That's going to have a spillover effect on your reputation, on your systems, on your people, your ability to hire. All those sort of things can be, I'm not saying they always are, but they can be impacted.
This next question is really a convergence of the top two topics we've heard this entire season, security and also AI. Are AI hackers using AI? And is there anything on the defender side that would help?
Yes, there is. In fact, this is going to be an interesting play over the next few years to see how this goes. AI is moving very rapidly. There's all kinds of ways in which it's being utilized, but there's also some things that you need to think in terms of. When you're playing this game, it's a little bit like playing a game of battleship. Because when you're the defending organization and you have the attacker on the other side, you want to make sure that as much as you can, obfuscate or make your assets and your people and your systems and your data unaccessible by another organization. Now, what AI does is come introduced into this is they create or introduce a few things that are on their side of the battleship. They'll do social engineering and phishing. Phishing, of course, is where you get these emails, that you see, and it says, click this link, or you need to check this, or will you transfer this money? I'm the CEO, transfer this money type of thing. And this goes into what we call a classification of hyper-personalization. So basically, these guys are scrubbing data using AI models and systems to scrub data from social media and other sources and profile targets and stuff like that. Additionally, AI is much better at grammar and language. So you can do an attack from anywhere in the world. If you don't know English that well, AI does. And because of that, they can get rid of the telltale signs of a scam or something like that. We've also seen just recently in Singapore, I think this was a financial institution, a bank, where basically there was a deep fake, where there was a video that was sent by a executive, or not by executive, but emulated an executive, and the person who was responsible for the controller side of the house basically transferred $500,000 out to or more out to an unauthorized user. So that's one thing. The other part is malware creation and obfuscation. So, for example, they use AI to make malware. They make it to where it can change quickly. The automation of development is there. So you don't have to be a coder anymore. It used to be when I started years ago with hackers, we had what we called script kiddies. These were kids in a basement that were doing fun, things like this and hacking for fun. Then, of course, it became a business. And then it got the governments involved and became a state type of thing. So that was one of the things that as AI is introduced is you have the ability now to pretty much do any type of coding without even knowing how to code. And you can create some really good malware that way. Wow. Also reconnaissance and exploration, vulnerability scanning, other type of exploitations like that, credential stuffing, all kind of different attack vectors that AI can emulate not only better, but faster.
That is scary.
Yes, it is.
For leaders staring at HIPAA, NIST, CSF, and SOC, how do you right-size a program? Like, what does a simple scorecard or dashboard look like? What would it include?
A simple scorecard, and you're right, that's a good point. You don't want to use a sledgehammer on the fly. And so what you want to do is basically make sure that you're addressing your risk. You have a basic program, a basic GRC program in place. It doesn't have to be elaborate for a 1, 2, 3 person practice. It can be very simple. In fact, AI can help you develop some of that information that you need to address that for your size of your organization. But for larger organizations, it does have to be much larger and a much wider scale. So what you want to do is evaluate. That's the first place you always begin. Do an assessment by looking at what are your policies and procedures, talking to your people, doing some interviews, especially with management, and then getting down in the weeds with people. Look at the systems. What are they connected to? What are they used for? Do they maintain patient information? This is what I call a data criticality analysis. It's the cornerstone of a whole policy procedure process, because if you don't know where your patient information is, which are your crown jewels for your organization, your crown jewels of your data, if you don't know where they're created, received, maintained, or transmitted, you're going to have a hard time defending it, which goes back to my philosophy. If you can't define it, you can't defend it.
Yeah. Let's talk about this next topic. And it's something that I would have never thought about years ago. And, for a lot of organizations that are working with multiple vendors, what are the concerns with that? I mean, because in some instances, you've granted them access to certain areas of your organization. And I imagine there are some concerns there.
There are. Supply chain in particular is a big thing. It's one of the areas that hackers oftentimes go to weasel their way, I guess you would say, into a healthcare organization, particularly hospitals and medical practices. They will look at options in terms of like, how do you, if you left anything in your directory services that perhaps is an old account that was left available, and maybe it was a vendor that was providing services for you from years ago. If they're able to breach your directory services and get those credentials, they will use those to try to get into your organization. Once inside the organization, they try to escalate to a different set or cross into a different set of credentials if they can find those and hack those credentials. Once they do that, they can escalate to a different level. And once they escalate to a different level, they can find where your crown jewels are and maybe gain access to those. Healthcare information in particular, you remember, has like names, emails, social security numbers, credit card numbers, financial data, all of that good stuff. It's just a treasure trove if they can actually get to that point and get to it.
Yeah. Let's talk about what a process would look like to engage with you and Allegrow, maybe a first step, and, as starting with an assessment and maybe moving on from there.
Yeah, I think the first thing that, when we work with clients, what we want to do is just first have a conversation, and let's talk about, what are you doing currently? What are your concerns? Where are the areas that you think need to be addressed? Is it your administrative function? Is it your technical controls? Is it your physical controls? How many site locations do you have? How many people do you employ? What systems are you utilizing? And just basically have what I call a coffee conversation just to start with, and talk about that to begin with. From there, if you find that an assessment is required, or you're interested in doing that so you can make sure that you can address your compliance requirements, then that's certainly the next step, and we're happy to talk with you about how that would look like as well.
Yeah. What is the biggest blind spot you see in executive teams? Something that they're just vastly overlooking?
Oh my goodness, that's got to be, well, there's several things I think that in the boards that I've worked with and the CEOs that I've worked with, time is a big constraint. Priorities. There's so many things that are going on in healthcare these days that you have to keep up with. That can easily override, what seemingly is a mundane or maybe even boring component, security, data security. And then finally, of course, is resources. Hospitals and healthcare providers are oftentimes limited in terms of their resources because of budget constraints, cost cuts, reimbursement scenarios that have changed, things like that. So from a CEO perspective or whatever, I would look at those three things, looking at it from a resource, the time, and what are your priorities. And if you should make an investment, in an assessment or a person or a system, look at that just the way you would look at any other, type of business thing. What is this going to do for me, and how much is it going to cost?
And in true healthcare CEO show fashion, we always finish with our final two questions. There's a saying that leaders are readers. Is there a book you've read over the 25 plus year journey that you would want to recommend to our readers today?
Yeah, that's an interesting question. And yeah, leaders are readers. I agree with that. I read a lot. And one of the things, particularly over the years, that I found was beneficial for me was a little book called How to Win Friends and Influence People by Dale Carnegie. The reason I say that was such an important one is because it teaches you the soft skills that oftentimes engineers or IT folks don't really have, because they've never been, really required to kind of operate in that function. So being able to have the soft skills to where you can not only go spend time with the engineering crew, but also time in the boardroom and be able to talk to people and understand, how people think and how, they operate, is a great service to be able to provide that to an organization, because in the end, it's really all about people. It's about systems and all that too, but it really, in the end, if you got good people who are looking out after your organization and you know how to work with them, they're going to be your best line of defense.
And the final words of wisdom comes from you. I turn over the mic, so to speak. What advice would you give to other CEOs and healthcare executives and leaders of healthcare organizations today that you would want them to know?
I would want them to know that this is an important thing. It's always been important. Obviously, I'm interested in and kind of made a career out of it, but it is an important component that a CEO needs to address, this risk management component of it in particular. Because running a business is tough enough without being able to know where your blind spots are. The worst thing that can happen to any manager, whether you're a CEO or you're just a frontline manager, is to be taken by, blindsided by something. And unfortunately, there's been too many times where I've gotten calls and they said, we need you to come in and work with us on this stuff because we just got hacked. We've had a breach. The Office of Civil Rights, was breathing down our neck on something. So can you come in and help us kind of get this all squared away? It's oftentimes, unfortunately, too far gone on some of the stuff. The breach has occurred. The data is gone. Cow's out of the barn, whatever you want to call it. Yeah. And so in that situation, I would say be proactive. Address these on the front end. If you know you have issues or you don't have a clear vision or a clear perspective of what that part of your business looks like, then find out. Don't get blindsided.
Chris, thanks for cutting through the noise and giving leaders a practical playbook, what matters, what to do first, and how to scale securely without adding chaos. For listeners, we'll include a simple readiness checklist and ways to connect with Chris about HIPAA, NIST assessments, SOC readiness, and fractional CISO support. If you're ready to get ahead of risk, book a free 30-minute consult with Allegrow security team to map your top 3 risks in a 90-day action plan. Reach out to Allegrow and we'll get you scheduled. Thanks for joining us today, Chris.
You bet. My pleasure.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.